Hello and welcome. This is the Visualizing Data with HealthLandscape webinar. My name is Michael Topmiller. I am the GIS Data Specialist at HealthLandscape. Today I'm going to walk you through a number of the tools that HealthLandscape has, and then I'll show you some examples of some of the sites and how they're being used currently. To give you a little background information on HealthLandscape, it was developed to fill the need for better decision making in the healthcare field. And with this, I'm referring to our kind of flagship site, HealthLandscape.org. HealthLandscape is actually a collaboration of two organizations, the Health Foundation of Greater Cincinnati, which actually just changed its name to Interact for Health, and the Robert Graham Center in Washington, D.C. The first iteration of HealthLandscape was launched in 2008, and our most recent version in 2011. We've been building web-based mapping tools since about 2007, 2006. So give you a little overview of what we're going to talk about today. I'm going to start with the HealthLandscape platform, which, let me turn off this timer here real fast. Okay, so I'm going to start with the HealthLandscape platform and then show you a few of the tools that are consistent or constant throughout most of our sites. Then I'm going to go into our community data portals, which we have for states, metropolitan regions, neighborhood level, a few different options you have for the community data portal. Then I'll talk about the Site Performance Explorer, the Location Explorer, and the rest of our Explorer tools, including the Workforce Explorer and Service Area Explorer. Now, if you have, we have a pretty good group today, good-sized group. If you have any questions or concerns, you can go ahead and type them into the box, but I don't know if I'll get to them until the very end, unless it seems to be a very pressing question. So if you see something that you like or you want to see again, feel free to write it down or put it in the question box, and at the end we'll have time to go through some specific things if you're interested. So the site that you're looking at, the page you're looking at now is healthlandscape.org, and I'm going to go ahead and log in. And we do have webinars, which you may be familiar with, that just focus on healthlandscape.org. And I'm just going to show you this just for a few minutes because all of the sites and the different tools that we create are all built upon the HealthLandscape platform that you're seeing here. Now, if you want an account, it's easy to sign up. It's free. But just to give you an idea of what HealthLandscape looks like is important because it is basically the base for all of our other tools that we have. So you can see on the right-hand side here we have a number of different things, quick maps, space maps, optional layers, layer controls. These are things that are constant on all of our sites. The way the layout is the same as well. So you have the share button, tools, which is important because all of the tools that I'm going to show you today eventually will be in this box here. So you can turn some things on, turn some things off. You also have print, draw functions, a couple of other things over here, some map, data, chart and graph tabs, a zoom bar. In the bottom of the screen, if we had some data here, we'll put something up. This is where your legend will be located with some descriptions. Going back to our tools here, I'm going to go ahead and talk about these for just a few minutes. So the Community Health View, Quick Geocodes, and Quick Themes, now these are tools that are on healthlandscape.org, but if you have a data portal or a site explorer type thing that I'm going to show you today, these are things that can be actually added on top of those other tools, and I'll show you some examples at the end of how that is. Community Health View, for those who don't know, is just basically a large data library where you can come in and search for different things and map different variables and export the data and do things like that. Quick geocodes and quick themes are ways you can bring your own data in. So if you have address level data or point level data, you can use quick geocodes to make those maps. And if you have county level or zip code level or smaller kind of geography data, you can use quick themes to get that data in and kind of visualize some of your own data. Now that was pretty quick. With that being said, I'm going to go ahead and move into some of the major visualization tools that we have in HealthLandscape. I'm going to start with Community Landscape. Now the Community Landscape site here is just basically houses all of our community data portal sites. So it has a description of what community data portals are and some different example sites and demo sites from around the country. Now what community data portals are basically are ways that regions or organizations or whoever you're with can actually take your own data and put it on your own site and make maps and other different visualization tools with that data. And you combine that data with national, local, or other types of data that are available. This will become more clear as we see a few examples. I'm going to go ahead and start with Facts Matter. Now, Facts Matter is our Cincinnati data portal. Now, it sits on the Community Research Collaborative site at the University of Cincinnati, so go ahead and click here to begin, and it will open up here in just a second. Now, what this has is basically data for just Cincinnati combined with data from the Census Bureau and other sources. So here we have a number of indicators that are all were selected by the people who developed or people that are behind this portal, which include a number of partners, including the United Way of Greater Cincinnati, Vision 2015, Agenda 360, different regional organizations. And as you can see here, we'll go ahead and click on Health, and I'll show you some examples of how different ways you can visualize data with the community data portal. So here we just have a pretty simple map of county groupings in the Cincinnati area. Now this Health tab here, and all the map you're looking at is actually from a local health survey. So it's actually a aggregate geographies that were put together for the purposes of reporting this survey. We also have, so we have a map which doesn't tell us a whole lot, so we only have a few geographies. But we have a data tab if we want to see that. So this is just one way to share this data with the public. We have a chart. Actually, we can look at the different geographies we see compared against benchmarks. And we also have trend data. Since this survey's been done, this is the fourth, I guess, iteration, 2010, we can see how some of these variables trend over time and compare the different regions. Now, in addition to kind of the local survey data, we also have some national level indicators that we put in just for Cincinnati. So here, population change, go to economy, we can look at poverty, actually look at by census tract. This is just data from the American Community Survey, just from the Census Bureau. So easily downloadable. We can make the maps here. We can also see the data. We also have our charts here as well with our bar graphs. Now this is just one simple example of how you can, of a data portal for a metropolitan region. Now we also can look at different ways of visualizing data, looking at dashboard type things, which are really popular these days. So we're building a site for the United Way of Kentucky. This is a demo site. It's not finished yet. But they have a number of indicators that they highlight as important, and they wanted to see how well the state of Kentucky is doing against national benchmarks or national indicators. So here I have kind of a simple little line here where red is bad, green is good, and kind of see how Kentucky does in comparison to a national benchmark. Now this is nice, but then we could also click on this, show me, and it will take us to a Kentucky data portal, which has all the same features that I just showed you with Facts Matter. So we have the maps at the county level here, where darker colors indicate higher rates of college readiness, and lower colors indicate lower rates of college readiness. I'm going to go ahead and switch gears here. So this is an example of a state site. I just showed you a metropolitan site. Now I'm going to go ahead and switch gears a little bit and show you a neighborhood level site. So this is the site I'm going to show you now is from the Our Kids Network organization in Halton, Canada, which is near Toronto. And basically what our Kids Network did was took a static PDF report that they have on this site, report card, which has a number of indicators they've been tracking from a local survey, a lot of other really good information about what is going on with the youth and adolescents in their region. And they took this report and basically, using a community data portal, turned it into a dynamic live website. And this is what it is, the our Kids Network data portal here. So they took all of the categories indicators from their static PDF and turned it into this dynamic website where they have all these 8 categories. Children are learning, safe education, health, family, a couple of other things. And so let's go ahead and select on some indicators. So let's look at development readiness at kindergarten. And here we have a neighborhood level map for development readiness where the darker colors indicate higher rates, as we can see in the legend down here in the bottom left-hand corner. Another thing with the data portal, which is true for most of our mapping tools, that when you select a geography here, notice that in the upper left-hand corner it gives us the name of the neighborhood along with the data associated. So now we're looking at the percent of 5-year-olds that are developmentally vulnerable in one or more categories. You see that 26% are for 2012 for rural North Halton. But we also have all the data for the other indicators that are part of that data file. And as we scroll over each of these geographies, it changes and other ones pop up. Also notice that if we go down to the bottom left-hand corner, we have our legend here. And we can change the colors if we'd like. We can change the number of categories. So you have some flexibility on how you visualize this data on the map. If you had different kinds of data, you could do different color schemes. Doesn't make a whole lot of sense for this data, but there's things you could change with that. We could also change the distribution if you wanted to from quantile to equal to interval. Excuse me. Another type of map that we can make that differs from the thematic maps that we've seen are threshold maps. So say we just want to look at the areas with the highest rates of kids that are developmentally vulnerable in one or more areas. So click on threshold here. We'll go ahead and change our color to red. Let's just go maybe to 30%, see what we got here. And this is just a way to pinpoint those areas with the highest rates. We see here that the neighborhood of Acton has 38% very high rates, and the neighborhood of South Central Oakville also has very high rates, almost 50%. So this is just a different way to look at the data, kind of to pinpoint those really high areas. We also still have the data tab with the graph along with different benchmarks that were chosen for this area, in addition to the trend data that we have, where we can turn on and off depending on the area we want to look at. Okay, so this site is a neighborhood level site. So this, we've seen a metro region, a state region, a neighborhood level. Now I'm going to move to another state level site that was developed for a little different, or actually a much different purpose. And this is the North Carolina Community Health Information Portal. And this site it sits on the website of the Community Care of North Carolina. And the Community Care basically takes care of roughly 90% of the Medicaid population in North Carolina. What they wanted to do was to take their Medicaid data, put that on a map, and then combine that with a number of other indicators, including some basic census indicators from the American Community Survey, some community health assessment variables from Robert Johnson, Healthy People, a bunch of other, this is from various sources, to go along with their Medicaid data that they have at the county level. Now, in addition to the public site that we're looking here, this is a public site that anybody can access. They have private sites where they have data at the clinic level. So if you work at a clinic in a certain region or you have certain privileges, you can actually see all of this data, same exact data, but at the clinic level as well. So there's definitely a few different options you have depending on what your organization is and what you're trying to do. Another tool that I haven't shown you yet that's part of our community data portals is our comparison tool in our side-by-side maps. So I'm going to go ahead and go to community characteristics, population. We'll go to Robert Wood Johnson. Now we'll go to population composition by county. Now what we're looking at here is we've heard a lot about in the last few years about the growing Latino population in different parts of the country. This is very true for the state of North Carolina. This is actually a research field of mine, looking at if you have high numbers of Latinos, an increase in Latinos, there's some anecdotal evidence and people complaining, whether it's true or not, about this leading to high use of emergency room or emergency department care due to a lack of other services or resources for Latino population. Now, there's some evidence to support this, but there's not a whole lot out there. But one way to begin to ask that question with Carolina is to look at a side-by-side map using this data portal. So here we have percent Hispanic by county, where the darker colors indicate higher rates. We're going to go ahead and add a secondary indicator and see if we can find an indicator that looks at emergency department cost. So we'll go ahead and go to health system performance, Medicaid, healthcare cost. Let's look for average monthly ED cost. Now, if you look at the map side by side, we're on the left hand, we have percent Hispanic. On the right hand, we have average monthly ED cost. There doesn't seem to be too much of a relationship. It's a little bit hard to tell. Maybe, and we have this kind of red outline showing us how what county is what county on the other side of the map. We also have our tooltip with our data depending on which side of the map we're looking at. Now this is nice, but it doesn't help us a whole lot. So let's go down to our bottom here. We have our thematic threshold. Let's look at a comparison map. This actually is using percentiles to put the two maps together to help highlight those areas that are in the highest percentile of percent Hispanic and those counties that are in the highest percentile of average monthly ED cost. So those are our blues, our highs and highs. So we can see that in Wake County, we have a high percentage of Hispanics for the state of North Carolina, in addition to high average monthly ED cost. So this is just another way to help explore relationships between two variables. So I'm going to go ahead and move away from our Community Data Portal and actually focus on our Site Performance Explorer. And what the Site Performance Explorer does is allows you to track different performance metrics looking at multiple sites. So this is point level data that we're talking about here. So I'm going to go ahead and show you a Service Explorer site that we built for school-based health centers in Cincinnati. Now, Interact for Health, the foundation which we're a part of, or subsidiary of, I should say, funds a lot of school-based health center issues or things in the city of Cincinnati. Now, the school-based health centers, they wanted to track how well the nurse practitioners and other people at the school-based health centers, how well students were following up with referrals that were being done for vision, dental, and hearing. And the idea is that right now we see this map and we have some red, some green, and some yellow. If we have some reds, that means that we have sites or a school-based health center where students are not doing that well of a job as far as actually completing their referrals when they're being referred for different services. So here for Cheviot, we have some pretty low referral completion rates here for dental, vision, and hearing. And on the other hand, we have the green dots are those areas, those schools that are doing better. And these are doing really good for dental and hearing, but just okay for vision. This is Mount Airy. So just a easy way to visualize or track progress or metrics at the site level for multiple indicators. You can also, if you're just interested in vision, if you click on vision here, it just shows you the data for vision, what's going on with vision, or hearing. It's one category at a time. Now this data actually, the idea behind this is it's updated monthly. So if you start the year with a lot of red dots, the idea is this data will be added onto, and students or school officials and school-based health center officials can see what's going on and help correct the situation. So eventually, by the end of the year, these dots hopefully will all be green. That's the idea behind this. Okay, the next site I want to show you is something that was it's actually still a work in progress, but it's actually a site explorer that we have, but also combined with a data portal. So for those of you that are familiar with the Centers for Medicaid and Medicare, they recently released a lot of data related to inpatient and outpatient hospital cost, some Medicare data related to how things vary across the country at the county level, the hospital level, at the hospital referral region level. So we've started to put some of this data into a site explorer and to a data portal. So there's just a few states here. So we have Kentucky, Ohio, Mississippi, and California. And we just added just a few different inpatient average covered charges at the hospital level for some lung conditions, heart conditions, kidney, substance abuse, and also added some patient recommendation data from the hospital compare. So if we'll go ahead and zoom into this area, since that's where we are located in Cincinnati. We see a lot of green dots indicating that lower hospital costs compared to the rest of the country. But we have some outliers here. If you look at this hospital here, we have some pretty high average covered charges for heart attacks, heart failures, and other inpatient diagnoses. We also have some patient recommendation data as well. So if we're interested in just one of these indicators, just heart, we can click on heart. We can see how well each hospital is doing in just that area. We also have the ability to filter. We just want to look at Ohio. We can just see just Ohio here by filtering just to the state. And if we want to see, just see those hospitals that were not recommended, those hospitals that we consider maybe bad hospitals because they were not recommended by more than 10% of patients. Here we just have one here. So let's go ahead and turn that off. We could also see, on the other hand, hospitals that were recommended by more than 75% of patients, and it kind of filters down to those hospitals. So it's a way to track different metrics as well as filter and see a number of different things. Now, in addition to the Cost Explorer, we also have a Medicare data portal. Give it a few minutes to load here. And basically it looks the same or very similar to the data portals that we've already seen. So let's go ahead and look at what does our Medicare population look like. Let's focus on maybe the dually eligibles for Medicaid. And this data is at the hospital referral region level. I'm actually working on putting together some county level data for this. So here we have darker colors indicate higher percents of dually eligibles for Medicare and Medicaid. And since it looks like it covered up our hospitals, I'm going to go ahead to layer controls here, and we'll move our hospital explorer to the top so we can see what our hospitals look like as far as costs compared to the Medicare population using the data portal. And with this, we have a data tab, like with all the other data portals. We have charts. If you want to look at benchmarks. We have graphs to see how well or what percents they change over time. So we have a lot of different options here as far as combining the different the different tools with the data portal, with the Site Explorer, and things like that. I'm going to go ahead and switch away from the Site Explorer and show you our next tool here. And this is our Location Explorer. And Location Explorer is similar to the Site Explorer, but it's more of a filtering tool than anything else. So the screen you're looking at now is actually a grant mapper that we created for Interact for Health. Interact for Health, we're a subsidiary of Interact for Health, so we created a grant mapper for them to track where they're giving grants and for how much, and the different length of the grants and things like that. So if we just want to see those higher amount of grants, we can filter to those. If we wanted to search for obesity, here we have obesity is related to this. Children's Hospital Medical Center. So you can see the name, the grant amount, how long the grant was for. We could select years here. Let's go ahead and reset this so you can see all of our grants. So this helps visualize where grants are being given in the city, and you can see that the darker purples indicate higher grants. So it's just a filtering tool that allows you to quickly kind of find what you're looking for in this area. The next tool I'm going to show you is the Workforce Explorer, which I'm going to show you the Primary Care Physician Mapper. And this is using the National Provider Index data. And here we're looking at basically the location of primary care physicians in a number of categories here across the U.S. and how it varies by different geographies. So we're going to have the state view. Let's go ahead and we'll zoom in here and we'll select county view. This might take a few minutes to load. What this does is it allows you to set thresholds so you can see those areas that have shortages of primary care physicians. You can actually search by specialty. You can filter different levels. We go to Kentucky. We'll go ahead and go to Cincinnati. You can actually filter this all the way down to the census tract level. This might take a long time. Hopefully it doesn't break the system. But it's a way to visualize what the workforce looks like across space, and you can filter and do things a number of ways to allow you to easily find what you're looking for. And again, we have the legend on the bottom left-hand corner of the screen. Now, this actually sits on the site of the Robert Graham Center, which is one of our partner agencies. Now the last tool, or the last site I'm going to show you before I just give a brief overview of some of our tools is the UDSmapper. If you worked with anything to do with the federally qualified health center, the health center grantee program, you're likely familiar with the UDSmapper, which actually, as of a couple of days ago, is a brand new site. So it actually looks more like HealthLandscape and the things I've shown you today than it does the old UDS. But it has a number of tools that you can use. The UDSmapper is free for use for anyone, so you can explore service areas. I'm not going to go into a lot of detail here because there's a lot of, you would need your own webinar to understand how to work the UDSmapper. I just wanted to let you know that it is here. And there are a number of tools you can use with this. I did want to show you a Service Area Explorer tool that is available to be built. We actually have built these for other things, but I can't show you any of those sites today. So if we want to see what the service area is for the healthcare connection right here in Cincinnati, it will actually calculate that service area where 75% of the patients are coming from at the ZICTA level. We can actually change that as needed. And we can also select different grantees and see where that service area overlaps. So there's a lot of overlap with the Witten Health Medical and Health Center. So it's another tool that is part of HealthLandscape. Now I'm going to go back to the Site Explorer, that inpatient hospital cost Site Explorer, and show you how a few of the tools I mentioned at the very beginning, so Community Health View, quick geocodes, and quick themes can be used kind of together. So you can actually, here we have our hospital data. What if we wanted to look at how does that vary if we look at some data behind that? So let's go ahead. This is mostly county level data. Let's go ahead and select economics. Let's go look at some income and poverty data from the American Community Survey. So hopefully this works well. Go ahead and we'll map by percent 200 below poverty. Here we have pretty quickly a county level map. Again, I'll use my layer controls here and move our points above our counties, and we'll see how does this vary if we just look at the data underneath. So this is useful when you're looking at cost data to compare actually what does it look like compared to the underlying areas. So just another way to kind of visualize this. Community Health View works similar to the data portal. Now you can actually add different indicators to the tooltip. So when you select a county, say Hamilton County, since Ohio here, you can actually see the other data as we've added it to the tooltip here, in addition to the data that we're mapping. You also have the ability to look at the data and export the data if you wanted to a CSV file. So there's a lot of different options you have with Community Health View. Go ahead and turn that off. And the last two things I wanted to show you is how you can bring your own data into this. I'm going to go ahead and turn on quick geocodes here. And real quickly, I'll pull the file. And we'll just pull up this here. This is some infant mortality data for the city of Cincinnati, with just some different variables for cause of death. So I'm going to go ahead. This is public data. I'm going to go ahead and copy this in here, paste it, and we have the information we need. So basically the important thing with this is just matching your address column, your zip code column, and other things to your categories over here. Go ahead and title it by address. We'll go ahead and map this by our low birth weight deaths. Go to geocode now. Pretty quickly, we can see what the infant mortality looks like in Hamilton County and see where our low birth weight deaths are, maybe look for patterns and things like that. We could also add some other data, optional layers that we have. So I'm going to see where they're located in relation to health centers. We could do that. We could also turn on either our data portal or hospital cost explorer and bring that data along with it. It might be a little messy here, but you see what I mean as far as the ability to combine different tools when you're working with HealthLandscape here. So I'm going to go ahead and turn off some of these and show you the last tool, which is Quick Themes. So this works very similar to Quick Geocodes, except that we're not mapping point level or address level data. We're just looking at some kind of geography. So in this case, county level data. Let's go ahead and pull this in. Go ahead and copy and paste. It works very similar in that we just have to match the type of geography to the FIPS code that we have here. And the important thing with Quick Themes is knowing what your FIPS code is for each geography. So if you're at a county level, it's a 5-digit FIPS. If you're at a census tract, it's 11-digit FIPS. Zip codes are just 5 digits. So once you figure that out, you just hit, we'll name it by county, and we'll map by percent diabetic with a foot exam. and we'll click load. This is for the state of North Carolina. So here we see darker colors are higher rates. And again, we have our tooltip that we could turn on and off here. We can see just some different things. And we could go ahead and turn on the Simulator tools, the data portal, or the Site Explorer to kind of explore some other relationships and some other things, depending on what we are interested in. So with that, I'm going to go ahead and turn it over to questions and concerns. There's a few questions that are already up. I'll go ahead and address those first, and then we can go ahead and talk about some more questions. So my information I have on the screen there. So if you have any questions after this webinar that I don't get to, or you think of something later on, feel free to email me or call me, and I'll do my best to answer your questions as well. So a question I have here is, can you follow skin cancer rates by state with some specific kinds of skin cancer? So really, that depends on the availability of data. I don't believe that we have any of that data in HealthLandscape or Community Health View right now, but it certainly could be in there. If the data is readily available and easy to get in, it's something we can definitely add to our system. That's no problem at all. Can you export the maps? Yes, I forgot to do that. Let me show you how it's done. So if we wanted to export this map for some reason, we just go ahead and hit print, and we have our dynamic printing thing here, so we can actually zoom in and out as needed. Take a few seconds because we have our health center layer on here, which I might turn off, which I will turn off because it's being too slow. There we go. There we go. So we can zoom in if we wanted to here. We have our legend. We have FQHCs are still on in the legend there. We can give it a title if we wanted to, and see diabetes. We can save this as a PDF. We can print it, cancel. Another thing that I forgot to show you, which actually I don't have turned on here, but we can see it here. If you wanted to share your data, say you're working on this and you wanted to show it to a colleague or someone, you can get a copy and put it into an email or whatever, and once you paste that or click on that, it will take you directly to this point on the map you're working on. Another thing I forgot to mention is with the quick geocodes and quick themes tools, you can actually, if you log in, which I can here, if you log in, you can actually save your maps and restore them. So say you're working on something, you like what you're doing, but you don't have time to finish it, you can actually save it and then come right back to it if you log in. You can do the same for quick themes as well. So you have a lot of different options with, so this is the map I was working on before, so it takes you directly to the point you were working on with that data. Is there any other questions, concerns? There's also a drawing tool, which I didn't mention, that you can use to, say you want to pinpoint, or you want to highlight this area here. You would change this color. You can label it if you'd like. Important area. And if you make a mistake, you can go ahead and erase. Or if you want to move, you can move this. So there's a lot of different things you can do with HealthLandscape and all of our tools in general. So we can go ahead and we could print this, or or save it as a PDF, or share it with a colleague or whoever might be interested in this map. Any other questions or concerns? Okay, so with that, I'm going to go ahead and end the webinar. I appreciate your attention, and like I said before, feel free to email me with any questions or concerns you might have, or things you think of later. Yeah, I do apologize. It was a lot of stuff that I showed in a pretty quick time period. We do have other webinars. We have an Introduction to HealthLandscape webinar, which many of you may have already signed up for. And we also have a webinar that just focuses on the data portals. It doesn't talk about some of these other things. So there's a lot of different things that we have. I know I kind of rushed through it, but like I said, I'm pretty available for further questions and follow-up. So you're welcome.